parenting is hard work. Now, parenting a special needs child, sometimes the stress level can get toxic, and we have seen families break because of they actually are now having to deal with a special needs child. So from the time that you receive your diagnosis, doesn't matter which type of specialist, we are clueless. Who do we talk to? Where do we go? Where do we even start? So this video is just meant to give you some just guidelines on what you can do as you parent your special needs child. The first thing that you need to do, the most important thing I would say is, please never lose yourself. You need to care about yourself. Self-care and self-compassion. You cannot pour from an empty cup. You cannot give what you do not have. So if you're not compassionate about yourself, if you do not care about yourself, what you're actually doing is being selfish to you and to your children. Because what has been said, if you see, when you're stressed, you're in a fight and a flight mode. And because you're in a fight and flight mode, everyone around you is going to receive that as a response. The same way you give yourself to care about your child, the same way you are compassionate about your child, is the same way you need to care about yourself and be compassionate about yourself. So what this means is you need to get time to stop. So you either arrange with your partner or a spouse, or if you have older children, or even you can have a nanny, a babysitter, who will be able to sit in for you for as short as 10 minutes to as long as 1 hour or even 2 hours, so that you are able to stop, go out. What you can do is you can read your favorite book, you can just have a warm bath, a relaxed bath, or you can meditate if you like to meditate, or you can just go out and walk, take time to exercise, take time to meet with your friends. For couples, you also need this time. Sometimes even just one evening, maybe twice in a month, or even once in a week if possible, where you just go out and just rejuvenate your love, rejuvenate your relationship and friendship, because sometimes the special needs child can come with a lot of demands. So the second thing is, if the special needs child is your firstborn, then you need to nurture the relationships of the people around you. That means now the relationship with your spouse or partner, or with the cousins, and now the sisters and the grandmas and the grandpa. Like, everyone needs to be involved with taking care of this special child. Or if now the special needs child came in as a second born or third born, or even a last born, maybe a family of 4 or 5 children, what you need to do is remember that there were other children who needed you as a parent before the arrival of this child. So make sure you get time to attend to their attentions as well. Because remember, just because you have a special needs child, it does not stop these other children being children. They still need you in the same mood, in the same joy and energy that they are used of. Then the second thing that you can do is, if possible, depending on how old these older siblings are, involve these other children in taking care of their younger one. They should be able to know what their sibling is having as far as the diagnosis is concerned, in the most simplistic manner, based on the age of their child, and give them a free will. If they are able to help, let them do. If they are not able to help, it's still okay. Then the other thing that you need to do is remember to be part of the society as you nurture relationships, the social help. Do not seclude yourself. I know there's a lot of stigma that comes with having a special needs child, but please do not seclude yourself. Usually what you give is what you receive. So if you give out positive energy about your special needs child, automatically most of the people will give you back the positive energy. Of course, there are those ones who just be stigmatizing and there's really nothing you can do about it. You may want to avoid such people. The third thing that you need to do is look at your child holistically. Yes, this is a child who has special needs, but this is a human being. They have a body, they have a soul, which has mind and emotions, and they have a spirit. Most of the special needs children are super sensitive in their spirit and in their soul. Why? Because the senses of their body sometimes are not very reliable because of, depending on the kind of disability that they do have. They have extremely sharp brains, especially for those, for example, those who have level 1 autism. They're very intelligent. So that's why it's very easy to see a person walks in and all of a sudden someone becomes happy, they smile or they laugh, or they will not want that person to touch them. So you may wish to look at your child holistically. If they do not want something, they have a reason. They will not be able to express their reason depending on their disability. However, they have a reason and you need to respect that. The second thing is you need to focus on the strengths of this child. It doesn't matter how bad their disability is, there's something good about this child. Sometimes you'll have to dig really, really deep to be able to appreciate what this child is carrying. But as a parent, that is your primary responsibility. When you see a child in a wheelchair, maybe they're drooling, that's the first thing, and automatically your brain is gravitated towards the negative things. But what else can this child do beyond the body that we see? Now that is really what you need to look out for. If you have stayed with your child for 3, 4, 5, 6 years, and maybe if your child needs to go to school, depending on the type of disability, you should be able to know the personality of your child. You should be able to know what makes your child happy. You should be able to know what interests your child has. So as much as you are able, you see, when it comes to caring of a child with a disability, not just about giving food and maybe changing the diaper, or maybe you need to activate their brain, their mental capacity. How do you engage your child? Because you need to know they cannot do this, but there's something that they can do. Sometimes you may need help from the specialists, from the healthcare professionals. But even when that is being done, you as a parent should look beyond the body of this child, please. The fourth thing that you need to do is develop a growth mindset. Usually there are 2 types of mindsets. We have the growth mindset and we have the fixed mindset. Mainly the difference between these 2 mindsets is how people look at problems or at challenges. Life is full of challenges. A fixed mindset, a person with a fixed mindset sees failure as the end game. A person with a growth mindset sees failure as the beginning of a new journey. And sometimes we have children who are born with these 2 mindsets, but sometimes we nurture this mindset based on how we parent our children. Children with ADHD, children with autism, especially the level 1, level 2 autism, they find school boring. It's usually like they find school boring. Most of the time they have the things that they love and they know they love these things. And when you take them to those things, they do exceedingly and exemplary well. So instead of you focusing your energy on the weaknesses, maybe it's high time you focus your energy on the strengths. And from there, you are going to build resilience. Because as someone who's autistic and they love something, you can never stop them doing what they love. So just put your child into a place where they like and see them flourish. So always think of that. Just because your child has special needs, you do not need to stop dreaming for your child. And the best way to do this is you reading about the condition that your child has. If your child has autism, be the expert in autism. Know all the people who are autistic and what they did and what worked for them. Use that information, put it in practice with your child based on your child's strengths and weaknesses. If your child has cerebral palsy, if your child has Down syndrome, if your child has ADHD, you as a parent need to be an expert. Because yes, you will need healthcare professionals, but just know these healthcare professionals are humans and they have limitations. We see in a clinic, especially in this clinic, you may end up seeing 10, 20 children, and all of these have special needs, and each one of them has their own diagnosis, and even if they have their own same diagnosis, they're in different levels. So it's only you who spends time with your child day in and day out will be able to notice what your child likes, will be able to notice what your child is good at, and use that information to tell to your doctor, to your healthcare providers, and draft a plan that will be suited for your child. And for other people who have, you do not have special needs child, but you have a neighbor who has a special need, or you know of a sister or cousin, or maybe a co-worker who has a special needs child. Please, number one, never talk behind their back. Number two, don't feel sorry, because these are children. If you notice that someone needs to talk, take time and talk to them. Not just say hi. Don't have this superficial relationship. If you really care, take time, sit with them, go out on a date with them. Sometimes even offer to babysit their child, depending on how close you are. Teach your children that they are children who have special needs in this world, and this is the way they're expected to treat them. Not pointing fingers, not calling names, not stigmatizing, like secluding them. That does not work. And once you start this training at home, when they go out, because special needs children are there, they are all around us. Chances are you know someone who has a child with special needs. Do make sure that you purposely take your children to go to interact with this child who has special needs. It's very important, because the special needs child need interaction from both children who are okay, quote unquote, and those who have special needs. Then last but not least, make mistakes. Always learn, always try out things, and it is okay to make mistakes. At the end of the day, it's your child's life that matters. Thank you so much for taking time to watch this.